Okay. Good afternoon. Thank you, everyone, for joining us. As many of you know, my name is Chris Rubish. I'm the president of the Minnesota Nurses Association. I'm an RN with Essentia Health. And today you will hear an important announcement from my colleague and friend, Sarah McCumber, who's one of our advanced practitioner group leaders. Before we begin, I just want to give you a couple housekeeping notes. First, we will be taking questions from the press at the end of the press conference today. Both Sarah and I will be available to answer questions. If you are a member of the press and would like to ask a question, please use the raised hand feature, and we can call on individuals in order that hands are raised. If you're not able to do that, you can type a question in chat, and we should be able to read those off as well. When called on, please introduce yourself and your news outlet before asking your question. So thank you for that. And with that, I will turn it over to my colleague and friend, Sarah McCumber.
Thanks, Chris. Good afternoon to everyone on this beautiful Monday morning. I'm sorry that we're having to meet like this, but my name is Sarah McCumber. I've had the privilege of working for 24 years as a nurse practitioner at Essentia Health, and I'm a member of the negotiating team for the Essentia East Market Advanced Practice Providers, APPs. Nearly 1 year ago, the advanced practice providers overwhelmingly elected to unionize and join the Minnesota Nurses Association as our union representatives so that we could have a say in our workplace and our working conditions. During that election, Essentia pledged to respect our decision and work with us. Our union election was certified by the National Labor Relations Board in July 2024, but since then, Essentia has continually broken the law by refusing to come to the bargaining table with APPs and by committing additional unfair labor practices. The union election notice specifically requires Essentia to bargain with the certified APP union, even during an appeals process. Essentia has refused to provide even one date for us to meet and negotiate our union contract or provide requested information. Throughout my long career as a nurse and as a nurse practitioner, I've witnessed firsthand how the role of advanced practice providers has expanded. We're seeing more patients, managing more complex care, and filling critical gaps in the healthcare system. Despite this growing responsibility, APPs have been excluded from meaningful participation in decisions that directly impact our work. And we need to be at the table to address how we can better care for our patients and improve our working conditions. The APP voice supports what our patients need and want. This is important so that our patients and communities have access to their trusted providers to continue to meet their healthcare needs. As APPs, we know what is best for our patients, and our input needs to be respected and included in providing care. When our input, the direct care providers, is not included in the workplace, APPs leave communities, become burned out, and are unable to provide the care to our patients. And patients feel the impact as well. Essentia stated in a recent news release that 44% of all patient encounters and 88% of all urgent care encounters are with an APP, signifying the importance of APPs in patient care. When providers are reassigned without adequate support or continuity, the quality of care declines, or not given adequate time to follow up on patient messages or other lab results, it makes it difficult for patients who rely on consistent relationships with their providers for effective treatment. Because of Essentia's unlawful actions, including unfair labor practices, Essentia's East Market advanced practice providers have submitted a 10-day notice today for APPs to go out on an unfair labor practice strike on July 10th at 7 a.m. As APPs, we are committed to serving our patients and communities. We live here. We are your neighbors and friends. We want to continue to provide exceptional care to our patients. We do not want to strike, but Essentia has left us no other option due to their unlawful behavior. So we call on Essentia to respect the law and partner with us to continue to provide exceptional care to our patients.